Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got 100% on my NPTE, and this led me to co-found SPT with me, which is an NPTE prep course. If you enjoy what you see in this lecture, check us out at sptwithme.com when you're studying for the NPTE. Now, onto what you're actually here for, let's talk about myasthenia gravis. Myasthenia gravis is an autoimmune disease. So this means that the body is attacking itself. What's happening on a physiological scale is that the body creates autoantibodies that attack our acetylcholine receptors on the postsynaptic cleft of the neuromuscular junction. So let's break that down. When you think about the neuromuscular junction, really consider where we are in space. So that's what we're going to look at on the left part of the image. Think about your peripheral nerve coming out from your spinal cord, and it's traveling all the way down towards, let's say, your biceps muscle. Well, whenever this nerve gets to the muscle, it looks like this. We zoom in and we can see the right side of this image. So that's when we see that nerve, which is the presynaptic membrane, and then there's a space called the synaptic cleft, and then this is where acetylcholine, the neurotransmitter, is going to make its way from the presynaptic membrane and travel to the postsynaptic membrane through that synaptic cleft, that space, which in this case happens to be a muscle. So the reason I bring this up is because often when there is a zoomed in picture, it's really hard to tell, where you are in space. It's so zoomed in. So sometimes this image is actually going from one nerve to another nerve. But in the case of the neuromuscular junction, it's exactly what it sounds like. It's a neuro, so nerve, muscular, muscle. So it's nerve to a muscle. So this is the pathophysiology of myasthenia gravis. Now, what can happen is that in this case, let's say your nerve is conducted through normally, and the vesicles that contain your acetylcholine neurotransmitters, they go through, and that's when we see the very right part of the image. So the part that's normal in myasthenia gravis is our acetylcholine transmitters are able to make it across the synaptic cleft, yes. However, the problem is that our autoantibodies that are created, given that this is an autoimmune disorder, these autoantibodies can do one of two things. One, just like in this image, they physically block the acetylcholine receptors from receiving anything. The second option of what can happen, and it's not shown in this image, but the autoantibodies can actually kill off and destroy acetylcholine receptors. So essentially they're disintegrated and they just don't exist anymore, so we have a fewer number of these receptors. Now, do these autoantibodies affect literally every single one of those receptors that are present? Keep in mind that there are millions of receptors, so the answer is no. They're not going to affect every single one. So there will still be access to be able to connect some acetylcholine neurotransmitters with their respective receptors. However, the amount that is able to do this is reduced, and if not, significantly reduced. As a result, this stimulus, or the stimulus to tell a muscle to contract, is also reduced. And this is why we see symptoms and signs like weakness in the affected body regions, our muscles. It's not that the muscles are all of a sudden just super fatigued. There's a physiological reason for that. Now, where exactly in the body does myasthenia gravis affect? Well, pretty much anywhere that has a neuromuscular junction. So anywhere and everywhere, upper extremities, lower extremities, diaphragm, trunk, neck, etc. Now, often we associate myasthenia gravis with extraocular muscles and the muscles that raise the eyelids. So these tend to be the ones that are more significantly affected relative to the rest of the body. Well, why? Why specifically the eye muscles? So actually for this, you kind of have to do some research. And I was able to find 2 articles that help us guide us in that direction. However, I will say that there has to be more research done on this because there's no truly conclusive answer, at least not yet. So there's a study done in 2008 by Soltis et al., and they find that the extraocular muscle junctions are more susceptible to antibody injuries than our other junctions in the body. So again, this is relative to all the other skeletal muscles throughout the body. Okay, so that's great, but again, why is that? Why is it more susceptible to injury? Another study was done in 2024 by Voluma et al., and they suggested that there is actually a difference in the development and the morphology of the neuromuscular junction when you compare the extraocular muscles with the rest of the skeletal muscles in the body. There suggests to be more subsynaptic nuclei present at the extraocular muscle, the junction. So their findings suggest that this could potentially be a reason why there is such great control and precision with eye muscles. Now again, this doesn't directly answer the why myasthenia gravis really occurs in this region. However, it does suggest that there is something different about our extraocular, neuromuscular junction relative to those in the rest of the body. So again, this clearly still needs to be researched a bit, but the fact that there is a difference between this region and other regions maybe kind of guides us into creating a rationale that we can use to explain why it's the extraocular muscles versus the rest of the body. Signs and symptoms of myasthenia gravis. So yes, you can't just memorize all of these. However, that again makes things very difficult. So the whole idea of SPT with me is to understand why these things are occurring. So let's make sense of it. The first two, droopy eyelids and double vision. The extraocular muscles are not working well. Remember, it's the eyelids and the extraocular muscles. So if the muscles of the eyelids are affected due to the fact that they are being attacked, the acetylcholine receptors are being attacked, then they're going to be droopy because they're not given enough stimulus, that attachment between acetylcholine neurotransmitter with their respective receptors. So they're not given enough stimulus to contract, to open their eyes, to raise the eyelids, to be able to see. Double vision. If our extraocular muscles are not working correctly, it's not that our eyes are not working in the exact same way. There's an imbalance between both eyes. So for example, your left eye might be stronger in general than your right eye. Maybe only certain of those extraocular muscles within the left eye are stronger, while the other muscles on the contralateral sides of the right eye are working. So it's kind of all up in the air how it works or how it's distributed. But our favorite answer is depends. But each eye is not working synchronously, which is why we have double vision. So that is generally how a person might present with and really start to make note of a change in their body, kind of a reason to check out whether or not this person has myasthenia gravis. Now the rest of the signs and symptoms. Remember, it's not only the eyes and the eyelids, it's weakness that can occur all over the body. Well, what are the muscles that we have in our body? We have facial muscles too. So making facial expressions are going to be more difficult. Again, autoantibodies are attacking acetylcholine receptors. So as many acetylcholine neurotransmitters there are in the synaptic cleft, it doesn't mean that they're able to connect to as many receptors as they normally would, because the receptors are destroyed or they're being blocked by the autoantibodies. Same thing with chewing and swallowing. We have muscles in our throat. We have muscles that help us chew. We have mastication. Slurred speech when we speak. We have muscles that help us do that, to help us speak. If our muscles aren't working as well, it's going to result in things like slurring. Now, of course, just in general, weak arms, weak legs, you think your diaphragm, shortness of breath, difficulty of breathing. Diaphragm is a muscle. Hopefully I was able to help answer some questions that you had about myasthenia gravis and touch on the maybe more important parts of it. If you enjoy this material when you're studying for the NPTE, check out sptwithme.com. If you're interested, check out these references for more information about myasthenia gravis.